Hello, my name is Véronique Cyr. I'm a registered nurse currently in the Masters of Nursing program at Athabasca University. Today I will present on the topic of leading inter and intra-professional collaboration in healthcare. I will begin with the definitions of the keywords of this presentation. Intra-professional collaboration is the collaboration between multiple people of the same profession, like a nurse collaborating with another nurse. Elitorminen and al. Highlight that collaboration and interprofessional relationships are essential for a healthy work environment as they affect the quality of care, patient outcomes, and staff welfare. Interprofessional is the collaboration between people from different professions. For example, a nurse collaborating with a pharmacist, a physician, or a therapist. Schott et al. Emphasize that all professions in healthcare are encouraged to work together. Their study found 3 ways to limit barriers between interprofessional staff members, which are bridging the professional, social, physical, and task-related gaps, negotiating overlaps in roles and tasks, and creating spaces to be able to do so. Radford and Blount defined collaboration as working with multiple partners to achieve a similar goal. In this presentation, I will use the word collaboration as a term to signify both inter- and intra-professional collaboration, as the strategies will be implemented for both groups. A professional is anyone working in healthcare, like nurses, personal support workers, physiotherapists, etc. For this presentation, I will be referring to research done in the nursing profession. However, these findings do translate into other professionals in the healthcare field. The abstract for this presentation gives an overview of what to expect and promotes it to other professionals wanting to learn more about inter- and intra-professional collaboration. An important leadership challenge in healthcare is promoting inter- and intra-professional collaboration. Collaboration with and between healthcare professionals is essential to providing safe and ethical care to patients. This presentation examines 3 strategies leaders can use to promote collaboration between team members. The 3 theories explored are the transformative leadership model, the interprofessional caring model, and the collaborative care model. The effectiveness of the presentation will be evaluated using Kirkpatrick's model, and feedback from the presenter will be offered with the feedback landscape framework. The goal of this presentation is to have participants collaborate more with members of their profession and other professions in their daily practice. I chose this leadership challenge because communication and collaboration are so important and essential to providing healthcare to patients. Radford and Blount have shown that nursing is a collaborative profession that is constantly evolving, and collaboration is necessary for the functioning of the practice. A study by Compton McBride et al. Found that having support systems for staff to feel comfortable communicating and collaborating with each other will improve nurse satisfaction and staff retention. Above all, Wei et al. Echo that collaboration among healthcare professionals is essential in creating cooperation to provide efficient, safe, high-quality patient care. The target audience for this presentation is all healthcare professionals at any level, from management to floor unit staff, and with any level of experience from novice to expert. The learning objectives of this presentation are to learn why collaboration is so important in healthcare and to learn some new strategies to improve inter- and interprofessional collaboration. The expected outcomes of this presentation are to have staff collaborate more within their profession for patient care. This can be done by working with at least one other staff member within their own field. The second outcome is to have staff members reach out to someone in another profession to collaborate. This can be done by contacting one staff member from a different field every shift to collaborate on a patient's care. The following 3 slides detail 3 different strategies leaders can use to promote collaboration between team members. Each theory has a different theme. One focuses on leading, the second focuses on caring, and the last focuses on collaboration. The first theory is the transformative leadership model, where leaders influence and empower others within the organization to achieve a common goal. Van Diegele et al. Explain that there are 4 I's to the theory: Idealized influence is how pride, respect, and trust are stimulated through developing a vision. Inspirational motivation is where high expectations are created through the leader's role modeling. Individualized consideration is the respect and responsibility fostered through personal attention to followers. And finally, intellectual stimulation is when leaders use new ideas and approaches to challenge their followers. So based on this theory, leaders can promote collaboration by role modeling good communication skills within the team members and challenging the team to collaborate more with other professions. The second theory is the interprofessional caring model. A culture of caring and human connection underpins interprofessional collaborative practice. Creating a caring culture is a dynamic process requiring all staff members' efforts. Wei et al. Outlined 5 processes through which caring can be fostered: building caring relationships, developing an ownership mentality, providing constructive feedback, applying the strengths-based practice, and acting as the first and last lines of defense. Leaders can use the processes of building caring relationships and providing constructive feedback to promote inter and interprofessional collaboration within their team. The third strategy is the collaborative care model. This model of mental health services is delivered in a primary care system through the collaboration between primary care providers, behavioral care managers, and consulting psychiatrists. The Improving Mood Promoting Access to Collaborative Care Treatment, or the IMPACT trial, demonstrated that patients in the collaborative care model system were more likely to continue antidepressant treatment, achieve prolonged remission of depression, report greater quality of life and self-efficacy, and have lower risk of developing cardiovascular disease. Furthermore, Smith et al. Have found that collaborative care model is one of the best models for enhancing engagement in depression treatment among underserved racial and ethnic minority populations. So this model is implemented in steps with in-service training, technical assistance, and continuous feedback. Leaders should use this model as a framework to use in other healthcare areas like the emergency or surgical departments to collaborate more with other professions. I used Kirkpatrick's model, which evaluates reaction, learning, behavior, and results to assess the strategies in this presentation. So reaction is the level of participant satisfaction with the implementation of the training. Learning is the level of learning of the training material. Behavior is the evaluation of the level of work behavior of training participants after returning to their work unit. The results are impacted of changes in the level of innovation development after attending the training. The results can be short or long-term results. So evaluation should be obtained for this presentation by asking participants to answer a questionnaire or survey after the presentation session. The questions would relate to the reaction to the material taught, what they have learned, behavioral changes that they will implement in their practice, and short-term results once they have implemented the behavior change. Feedback from the evaluations will be provided with help from the feedback landscape. This framework focuses on 12 principles of effective feedback. For this presentation, the actions that will be used are ensuring that all resources are available to participants via virtual learning environments. Secondly, ensuring support is in place to help participants develop self-assessment skills, including training and peer feedback. And finally, providing training opportunities for staff to enhance their understanding of the shared knowledge. Overall, the preceptor of the presentation should ensure that the participants' feedback is heard and make the appropriate adjustments to the presentation for future sessions. In conclusion, this presentation aims to teach healthcare staff the importance of collaboration in healthcare and strategies to improve inter- and intra-professional collaborative practice. Leaders can promote inter- and intraprofessional collaboration using the transformative leadership, interprofessional, and collaborative care models. Lastly, the presentation evaluation will use Kirkpatrick's evaluation model and parts of the feedback landscape. So here is a list of all the references used in this presentation. I have also linked my ePortfolio website at the top where you can find more information on me and all my projects for my master's program. So I just want to thank you for attending the presentation today, and I look forward to your feedback. Have a great day.